Hi, I'm Cheryl Latta, the HR generalist here at DoveLewis. I'm joined today by Snyder from Live Again, a local nonprofit here in Portland, Oregon, specializing in suicide prevention and awareness. Today we're going to talk about some suicide facts, some ways to prevent suicide in both yourself and in loved ones, and talk a little bit about more just the stigma and the awareness of suicide here in our local community. So I think this is a very important conversation, and the reason we're having it here today is suicide can be very prevalent, and mental health issues and depression can be very prevalent in our industry, in the veterinary industry. A lot of times our employees and friends will suffer from compassion fatigue, burnout. We see a lot of sad, hard cases. Are there certain industries that you think might be more prone to having mental illness issues or suicidal possibilities?
Right. I mean, any kind of medical profession of any kind does have a higher risk. There's just an exposure to patients and people that you just pour out compassion, and your job is being compassionate and caring for people, as well as you are exposed to violence in some kind of, there does become a desensitization to a little bit to what is violent, and that can be a risk, and understanding of means or access to means. And a huge piece of it is just being able to communicate with each other and setting up systems. And this is wonderful that DoveLewis is just saying, hey, we want to be a part of this conversation. We want our employees and to understand that this is okay to talk about. So yeah, there's definitely certain people in certain professions that are at higher risk, and a lot of it is when there's a community that's not willing to have open conversations about it.
Let's talk a little bit about the stigma surrounding suicide and depression and maybe mental health as a whole, and why that conversation matters and why it's important.
Right. Yeah. A way just to quickly understand that there is a stigma around mental health is I Googled the word mental illness, and the three suggested responses are mental illness is real, mental illness is not real, mental illness is a myth. So without even getting into resources, without even getting into how we can find help, already our culture, the popular search is trying to figure out if it's even a real thing. So there's tons of stigma just surrounding the subject, and we're in a culture where we do talk about mental illness or mental health struggles. It's extreme cases, and it's extreme cases of violence, and so there's fear associated with it. And the truth is, if someone's struggling with mental health, they're more likely to be a victim than a perpetrator of any kind of violent crime.
I think there's also a stigma too with people feeling maybe they're viewed as weak or incompetent or incapable if they have mental illness or depression or suicidal thoughts. Yep,
we're in a very pull yourself up by your bootstraps. You wouldn't say to someone who had a flu, you wouldn't say have you ever tried not having the flu? Have you ever tried just trying a little harder? Just feel a little bit better.
So talking about the stigma, let's talk a little bit about some strategies that maybe we can use in ourselves and in our community to help break down that stigma.
Sure. I think the first step is just learning more. NAMI is another organization that's a really great way just to learn some simple facts about mental health. 1 in 4 adults are struggling with some kind of mental illness in any given year. And so just that number alone says this is not some strange, unknown problem. This is something that is happening in our society and that we need to be talking about. So learning more, changing your vocabulary, and just realizing that we need to have conversations and talk about mental health.
Let's talk a little bit about statistics about suicide here, maybe locally or nationally, what statistics really are. I don't think people have a full understanding of what numbers really are.
Yeah, it's much more of a prevalent cause of death than we even think about, sadly enough. World Health Organization says that a suicide occurs about every 12 minutes in America, and estimated there's about 20 times as many suicide attempts happening.
Statistic-wise, is there maybe something more male versus female, different communities, different areas of living that tend to increase those statistics?
A lot of the male-female thing is interesting. Men are 4 times more likely to die by suicide than women, but women are 3 times more likely to have suicidal thoughts. A lot of the difference comes from means of death, and there is a great website, meansmatter.org, that's Harvard research done on reducing how you can reduce means.
If somebody does need help, how might they recognize that within themselves, and what might be some resources or first steps that they can take to really acknowledge that they might need help and to reach out for help?
Sure. I think that there's a few signs just to look for, and they are just maybe not feeling like yourself, easily aggravated, easily irritated, excessive worry, excessive sadness, any kind of feelings of hopelessness. And we're all going to go through struggles in life and times where we need to mourn or times where we need to be sad, but when that starts lasting 2 weeks or more, that's when you need to be concerned and say, hey, I might need to ask for some help. I might need to check in with a mental health professional, and that's really the first step. If you're at the point of crisis or if you're having suicidal thoughts, I would say before trying to make an appointment and wait till that appointment comes, make the call immediately. Reach out, get help immediately. There is a National Suicide Prevention Lifeline at 1-800-273-TALK, and there's also the crisis text line. You text START to the number 741-741. And those people are going to immediately engage with you and have a conversation about you. There's no judgment, and you're able to they'll help you walk through the first steps of that and then be able to connect you to other resources.
Great. What about if you are concerned about a loved one or even a coworker or family member of them maybe feeling like they might be at risk? What are some delicate ways that you can approach that as a family member or a loved one or a friend or even just an acquaintance?
Simply, setting a time to sit down and ask, hey, I see that you're struggling. I see this is going on. Are you okay? Reassuring them with saying, I'm there for you and I want to help you work through this, and avoiding some of those bumper sticker statements that everything will be okay, because those statements can be isolating and also just kind of feel like, I guess this is all on me. Furthermore, if there is any concern of suicide, that might come through them literally saying something as I'm thinking about suicide, or more likely it's less direct. It's more, I just don't think I can do this anymore. I don't want to wake up tomorrow.
Or you can see social media posts
right.
hinting at things like that these days.
Social media is huge for when you see that. In those cases, if there is a concern about suicide, the best thing to do is to take that head on. And in the conversation, say, hey, I saw this thing, I heard this thing, I'm concerned, are you thinking about suicide? And that is an incredibly overwhelming thing to think about trying to ask, but all research shows that if someone's not thinking about suicide, you're not giving them the idea. That's not what's happening. But if someone is thinking about suicide, this doesn't increase the risk, it greatly decreases the risk. It's shown that it brings anxiety down. It's showing that the stigma that they're attaching to this thing that they might be thinking about, you're saying, hey, I care about you, I want to be here for you, I'm willing to talk about this really difficult thing.
That's great advice. So let's talk a little bit about Live Again and how people can learn more and maybe get involved with Live Again here in Portland.
Right. So the best way to connect with us is any kind of social media. We're on Facebook at liveagain.org, as well as on Instagram and Twitter. We also have our website, liveagain.org. And we're basically just trying to help start the conversation. So if you want to bring us or a representative from us to your community, to your workplace, to your school, contact us and we'll actually customize a training or a workshop on just how to get conversations started. We also do projects around the city. We do hearts around the city for Valentine's Day, and there's a team of volunteers that puts up hearts around the city secretly that let people know that they matter. It says you matter and has some hashtags that connect to other resources. So the best way to connect with us is just get on our website, contact us, and we're probably up to some wild project just to try to help get conversations started, or ask us to come join you in your community.
I want to thank you so much for coming in today to chat with us about this a very important issue, a very timely issue as well. And we invite everybody to look at your local resources, look at the resources provided available to you through this conversation here, and reach out if you feel that you need it.